This is Tom Bernanke, and today I'm talking about horizontal nail lines. So if your nails have lines across them, this can be a symptom of a serious underlying condition. And we're going to go over the top 10 remedies as well. We're starting now. Horizontal lines across your fingernails and toenails are called Beau's lines or Beau's ridges, and they develop across the nails. This happens when the nail growth is interrupted at the nail matrix. So this isn't a Keanu Reeves movie, but the nail matrix is the stem cells at the root of the nail that grow the nail out. And what happens is when you go through a significant problem or disruption to your health, then that nail matrix has to stop producing the nail. There's a few dangerous causes of Beau's lines, or there's a couple safe causes. So they can be a huge indicator of a more serious health problem. And I'll tell you, for most of my patients, usually it's something safe, but I have had cases where a patient has clear signs of something going on where we want to evaluate it. Usually the number one cause of Beau's line is an injury. Like you jam your finger, you stub your finger, but it can be a severe illness. It could be environmental factors. You have to get to the underlying condition to take care of it. What do Beau's lines look like? Beau's lines are horizontal indentations or ridge, so they go from side to side. These are different than vertical nail ridges. They usually run straight across the nail. They could happen on one nail, or they can happen across all your nails. So what causes Beau's lines specifically? Number one, most common cause is mostly injuries. So if it's just on one finger, for example, you probably jammed that finger. You probably knocked that nail back into its root where it jammed. Picking at the nails or the cuticles can do it. Getting an infection around the edge of the nail can do it. Getting a manicure could do it. Essentially poking in there could jam it. The appearance of Beau's lines may offer more into their cause. More than one line on one of your nails is usually a sign of repeated external injury or an infection. So it's something that keeps happening. If it's usually just one line on one finger, that means it was one event that probably happened a month or two ago. However, if you have more than one nail with Beau's lines, the cause is likely an illness, prolonged exposure to certain environmental factors, or potentially a chronic disease. And this is when you want to investigate more. Some of the most common causes of Beau's lines, and these are the ones you have to be aware of, is an acute kidney disease. So acute kidney disease or kidney failure, this is when your kidneys shut down for a day or two at a time. This is serious and can require a medical emergency. This can be kidney infections, abdominal pain, prior kidney issues, high blood pressure. So if you have high blood pressure, if you have heart disease, liver disease, or diabetes, this could cause Beau's lines. One of the most common reasons I see it is peripheral arterial disease. I saw a study that said that almost 50% of people in America over the age of 18 will develop some degree of peripheral arterial disease. And as we get older, our blood flow gets poorer down to our toes, especially in the winter when it's colder, we're not moving around as much. Nail metabolism can slow down and you could develop a Beau's line during the winter. If you have acute kidney disease, the symptoms might be problems with urination, chest pain, confusion, swelling in your extremities, being tired, nausea, or worse. Another cause is mumps. Mumps is a highly contagious virus affecting the salivary glands. If you have mumps, you may notice that one of your glands are swollen. Complications are rare, but they can lead to issues like Beau's lines. This in the United States is very rare. This is more for my worldwide listeners. Thyroid disease. This is a little bit more common. The thyroid is essentially in your neck. These hormones regulate everything from growth to metabolism. Various thyroid disorders can contribute to Beau's lines. This includes hyperthyroidism, hypothyroidism, Hashimoto's disease. Often people with thyroid issues have weight gain, anxiety, low energy level, and poor tolerance of cold and heat. So you're cold or hot all the time. Syphilis. This is probably a little bit more rare. This is a sexual disease, or it can be inherited upon birth from the mother to the child. This starts out as a few sores. Usually penicillin can successfully clear of syphilis, but if left untreated, it can cause significant issues. And the common cause that I see is a side effect of chemotherapy. It's common for chemotherapy to interrupt or temporarily impair nail growth from the nail matrix. This can result in Beau's lines formings. Endocarditis. This is a term used to swelling of the inner heart's lining. This is called the endocardium. If the inside part is swollen, this could be an infectious bacteria. And melanoma, this is essentially cancer that can develop under your nail. If you have discoloration, signs of bleeding, this could be essentially a skin cancer underneath your nail. Here's the trick to tell if you have melanoma. See how the black streak here is actually going into the skin. So at the root, it's going through the nail and into the skin. That's something called a Hutchinson sign. That means it's more likely to be a melanoma. On the other hand, if it's not going into the skin, that's a little bit more common. And many people do have some black lines, some fungus, but that's what happened to Bob Marley right here. You can see he jammed his toe and thought it was a soccer injury. And for a long time, he did not treat it, but it was actually melanoma in his toe that spread to his body. If it's a line, you can see on the left-hand side, that's called melanoma. That's just pigment changes, or that's some debris or dry blood underneath your nail. If on the right-hand side, you can see it's yellow, there's some darkness, that's more toenail fungus. That's extremely common and many people get that. This is actually what happened at Bob Marley. He thought he kicked a soccer ball and it wasn't getting better for months, but ends up he had a skin cancer underneath his toenail that was making his nail look really weird and disrupted. A common sign of a subungual melanoma is the discoloration of the nail bed. This could have a brown stripe or a section. This is called the Hutchinson sign. But on the other hand here, you can see that it's stretching into the skin. If the skin is dark as well as the nail, that's a sign that you should probably get checked out pretty quickly and have that evaluated. Diabetes. People with diabetes to monitor their blood sugar and dose their insulin. If the blood sugar is too high, your nail growth could slow down. And that's why a lot of my diabetic patients have nail fungus and thick detached nails. Pneumonia is a bacterial infection in your lungs. If you're having a hard time breathing or spitting up fluid, this can lead to phlegm, chills, trouble breathing. This can be bacteria, viruses. Scarlet fever. This is an illness that sometimes affects people who have strep throat. People who develop scarlet fever have bright red rashes covering a large portion of their body and a sore throat. Vitamin deficiencies. So this can happen. Zinc deficiency is common. Zinc is a mineral found in many foods in our diet, including beans and oysters. A lack of zinc may be caused by a poor diet. A zinc deficiency could lead to a loss of appetite, poor immune function, and nail grooves. Zinc deficiencies are surprisingly common. They're up to 45 or more % of the population, and you just need 15 to 30 milligrams daily dose. It's found in your diet, or you can take a daily multivitamin. But this can prevent white spots, brittle nails, slow growth, or abnormal nail shape. Other types of horizontal ridges that you want to consider outside of Beau's lines. A black line on the nail is known as a splinter hemorrhage. This could be caused by jamming or breaking your nail on your finger or your toe, but it can also be psoriasis. If the line is black or brown, this could be something called melanoma. This condition may be harmless. It could be a sign of health issues, or it could be trauma. There's also something called Terry's nails, where the nails turn white. This can commonly affect people with liver disease. Nails that look half light and half dark are called Lindsay's nails, and these are connected to liver disease. White spots on the nails are known as leukonychia. It's common, it's a harmless issue with an injury to the nail matrix, usually with manicures or acrylic nails. Other common nail changes are brittle nails. This means your nail is probably dehydrated or you just removed nail polish. That is extremely common, especially in areas where you're not getting enough oil or cream, or you're dishwashing quite a bit. Yellow nails, that usually means that there's fungus on the top of your nail. This is extremely common. You could get it under your nail or you could get it on top of your nail. This usually means your nail's loose and it's not getting blood flow. White spots, that's a lot of what we're talking about today. That could be jamming, that could be Beau's lines, that could mean it's a health issue. Vertical lines, these could be vitamin deficiencies. These could be dehydrated, weakened, and split nails. You could see a Beau's line is a little bit more of a long-term chronic issue. That's what we're talking about here, whereas white spots are more of a traumatic nail jamming. You can see this is an example of a melanoma. Most of the time, if it's not in the skin, it might not be a melanoma, but if it's a streak, if it's getting bigger, if there's bleeding, that's definitely something you want to check out because it can lead to dangerous changes for sure. But if you simply have ridges like this could be more of vitamin deficiency. You could see that could be jamming. There's some bruising at the root of this nail. I did a lot of videos about horizontal nail ridges, black streaks, white lines, white nails, all the nail problems. I link those below, including the top 15 skin problems on your hands, on your feet. I review all of those. If you have any other skin problems or issues, check those out below. How do you treat Beau's lines? Beau's lines treatments. Nails grow very slowly. It can take over 6 months to grow a fingernail and over 12 months to grow a toenail. Filling your diet with rich vitamins can be very helpful, but here's our top 10 home remedies. Number 1, you want to eat a balanced diet. Vitamins that are associated with nail growth are vitamins A, vitamin C, D, and E, as well as a B complex and minerals like zinc, iron, calcium. On top of zinc deficiencies, iron deficiencies are very common. Up to 1/3 of women worldwide and about 1 out of 8 men have an iron deficiency anemia. And this is simply correctable with 10 to 15 milligrams per day. It's going to give you more energy and it helps with brittle nails, ridge nails, and pale nails. I go over vitamin deficiencies a lot in my videos. And for example, vitamin D, 78% of people can be deficient in vitamin D. So sometimes if you're getting these, it might be a sign of a deficiency potentially. Number 2, hydration. Keep yourself well hydrated. Drinking plenty of water is essential for maintaining the health of your nail and skin. While water is important, that's different than like washing your fingers because that could cause damage and dehydrate your toenails. We're talking about drinking your basic 8 glasses per day. Number 3, nail care. Practicing good smoothing, filing, and clipping. This is probably one of the easiest and simplest things. Nail files, clipping, smoothing, avoiding harsh chemicals. If you're a dishwasher or if you work with chemicals, maybe consider wearing some gloves. Moisturize. This is very important. Regularly applying a moisturizer to your nails and cuticles. I love to use oils like coconut oil, vitamin E oils. There's even waxes. There's a brand called Burt's Beeswax, which is very effective. Avoid harsh treatments. Minimize the use of nail polishes or removers. For example, if you're removing nail polish, that uses a chemical called acetone. So those $2-3 ones can ruin and dehydrate your nails. You can get ones with tea tree oil for like $10-15 that don't destroy your nail. And I link some of those below. Biotin supplements. Biotin, a B vitamin, is often recommended for improving nail strength and quality. This also helps with hair. However, if you have a vitamin deficiency, you might want to get that checked out first. Protein intake. Nails are made of keratin, a type of protein. If you're severely malnutrition from protein, and in fact, in America, we're not getting enough protein on average. We're getting too much carbs and processed food now, but not enough protein. A poor protein diet can be bad for nail health. Gentle nail care tools. So be careful, don't pick, scratch, scrape. Use a nail file, use clippers, and avoid exposure to extreme cold. Wear gloves during cold weather to protect your nails from the harsh environment. And somebody did send me these heated gloves. I actually used them because it's been freezing in Michigan. These are great. You plug them into USB and they're heated on the inside. There was a day where we were in the negative Fahrenheit and I had to snowplow in the morning. This really came in handy. I love these. These are Nebron. I enjoyed these. They got some pretty good reviews. Check them out down below on Amazon. If your fingers get cold, if they spasm, if they ache, if you have cold hands and feet, check out my guide on cold hands and feet, but also check out my guides on vertical nail ridges and other nail problems. I got those linked below.